health in every decision. To put that in context, I'm going to present 3 context statements. The first is, in 2014, the total amount of biomedical knowledge in the world was doubling once a year. So if you're graduating from medical school in 1900, it was 150 years. In 2014, every year, the total amount of biomedical knowledge in the world was doubling. In 2020, imagine in your mind what that is. 2020, every week, it'll double. And in 2022, it's possible that it can get down to minutes and seconds. So that's one aspect that we have to think about. Total amount of biomedical knowledge. That includes, should I operate on this patient or not? Should I send this patient, discharge this patient home today? What's the best therapy for this heart failure patient in terms of diuretics? Second thing is, somewhere in some small town, a family member and their doctor and nurses are trying to determine, should I take my mom off life support? Are there other therapeutic options that I have? That's just one decision out of 1 billion medical decisions that are occurring around the United States daily. And you're marrying that against a doubling time of biomedical knowledge that's going to soon approach minutes. And third thing we're realizing is that medical decisions increasingly are dependent on factors that are outside of the healthcare system. That the social determinants, in terms of your family support, your social services, the environment you live in, have 60 to 70% of the impact on medium and long-term clinical outcomes than the actual clinical decisions we make. So PIECES Technologies was designed to help solve these problems. And the first thing is we have 2 main areas that we focus on. PIECES Decision Sciences, or PIECES DS, is an artificial intelligence system that we've been training to think like a physician. So imagine applying an AI system that's able to take all the knowledge that we know that exists in the biomedical literature, combine it with the nuance that a physician or nurse would apply, and approach that for all of the decisions across the entire healthcare system enterprise. From surgery, pediatrics, medicine, obstetrics and gynecology, we have a growing library of models that we support. The second thing that PIECES does is if we recognize that the decisions that are made are outside of the hospital walls itself. And increasingly, we need to take data from other organizations that are part of a community. We talked about connected communities earlier. We think healthcare and hospitals and clinics are just one part of a much larger citywide ecosystem that involves the educational system, housing, food, family, social support. All of that decision making needs to come in intertwined with medical decisions to make that one decision for that patient at that moment, and then apply that to 1 billion decisions that are occurring daily. We've been really fortunate to be based in Dallas. You heard our story. I'm a physician trained in biomedical informatics. Led this work at UT Southwestern in the Department of Biomedical Informatics and at Parkland Hospital where we spun out. And we had the fortune in Dallas to spend 5 to 6 years working on the science of this. We won $50 million in grants from the NIH, the NCI, National Science Foundation. And then in 2016, we spun out, and we're now going across the country with our software. We're live across all of Baylor's North Texas Hospital. Every patient that comes to Baylor is evaluated by the PIECES system. Children's, Parkland, and we're spreading to hospitals nationwide. We're incredibly grateful for the innovation, for the support, for the investment from the North Texas community. Very excited about the future. Thanks.